Hello, and welcome back to the Chronically Positive Podcast. I am so excited about today's episode. Before we get into it, please make sure to rate, subscribe, and follow. It really helps get this podcast out to people who are going to benefit from these amazing stories that are shared. This is our third to last episode of the season. We are wrapping things up. I'm going to be releasing some details about season 2. It is already in the works. Really excited. This topic that we're going to be discussing is so incredibly important. It is going to benefit so many people with chronic illnesses. And without further ado, welcome Olivia. I'm so excited to introduce you to Olivia, a 28-year-old physician assistant student from Hamilton, Ontario, Canada. Olivia developed POTS in 2021 following a concussion and has been navigating life as both a patient and a healthcare provider in training. Before her diagnosis, Olivia was an elite athlete competing in windsurfing at the Olympic level and representing Canada at major events like the 2019 Pan American Games. Now, as a passionate disability advocate and the founder of Minorities in Medicine, Olivia is breaking down barriers in healthcare and proving that disabled people absolutely belong in the field. Without further ado, welcome Olivia.
Thank you so much. That was such a lovely introduction. I'm actually 29, since my birthday happened, since I sent you that, but
those are listening. We have, this has been like 2 months that we've been trying.
Yes.
So some time has passed. Olivia was supposed to be one of the first people actually on the podcast. And now she's wrapping it up towards the end of this first season.
But so glad to be here.
I have so many questions for you because your story seems very jam-packed and very interesting. And so I guess, should we start with the windsurfing and make our way through?
Sure, wherever you want to start in the journey.
Or whatever you feel makes the most sense. Because
makes sense. Yeah.
Okay, you hadn't been dealing with chronic illness your whole life. This is something that was developed from an injury. And was that from windsurfing, or was that completely separate?
No, it was completely separate. Yeah.
Wow. So what happened?
I was in an accident when I was skating a few years ago. I think just about 3 years. And somebody hit me from behind while I was skating, and then I just fell backwards. I got a concussion. From that, I basically had post-concussion syndrome, which was very familiar to me. I've had prior post-concussion syndrome. Yeah. But then I distinctly noticed all these strange symptoms like shortness of breath and dizziness and post-exertional malaise and fatigue and all of that kind of just hit me like a ton of bricks all at once. And then I kind of realized, I think I have POTS, went to my doctor, got worked up for it. Sure enough, I have POTS. Here we are. Yeah.
So were you still competing during that time?
No. So I competed, I guess for the 2016, I was campaigning for the 2016 and the 2020 Olympics. And then I retired when I didn't qualify for 2020. And that was obviously a tough decision, but I had some musculoskeletal injuries at the time that I needed surgery done on my hand, and then funding was also an issue. There were several factors that went into me retiring. And I also knew I wanted to pursue more education and kind of get into healthcare. So retired in 2020. Then, I started the physician assistant program in 2021. And then just after my first semester of PA school, that's when that accident happened. And I developed POTS. So then I ended up taking a year off of PA school, because the way it works in my program is if you miss more than a week, they ask you to take a year off, because it's such an intensive program. Yeah. So that was a very tough decision for me, but I think at the end of the day, it was right, at least for me, to take some time and get the diagnosis and kind of figure out how to move forward. So then I resumed school after that year off, and then I've just been kind of making my way through with accommodations, with mobility aids, and adapting to life with chronic illness.
Yes. Yeah. So when you started having those symptoms, because you're in the medical field, did you kind of know right away what was going on, or was it more of a mystery?
So the only reason I knew about POTS is because I actually have a close friend from high school, and she was diagnosed with POTS, like when, shortly before I was, a few years. So I kind of had this like circling in the back of my mind. And then all of a sudden, I think I was scrolling on Instagram one day and something popped up about like dysautonomia and concussion. And I was like, oh, that's weird. I feel like that's what I have.
Yeah.
And then I Googled like, how do you test for POTS? And I did like a poor man's tilt table test with my parents at home, got my heart rate monitor on, got the blood pressure. I calculated everything. I met the minimum like threshold of like 30 beats per minute changing, sustained over 2 minutes from lying to standing. And then I brought that to my doctor and I was like, I have POTS. Please send me to the appropriate provider. So for me, like, thankfully, it was a lot easier than a lot of people have it. And I recognize that if I didn't know all the symptoms and come to my doctor with the data, I probably wouldn't be believed. And my family doctor did not know what POTS was also when I went to her. So.
Oh, interesting. So what did they say? What did they do?
They said they would read up on it with my data, and they did read up on it, and they agreed that I met the criteria, and they referred me. So, like, everything worked out in the end.
Well, that's great. I'm glad that because I know a lot of people, myself, like, you start developing these symptoms. You don't have a medical background. Like, you don't know what's going on, and you're just like, what is happening to me? You go to a doctor. So it's really interesting to hear perspective from someone who really knows about the human body. Well, if you're listening, we took a break and we came back and you don't remember what we were talking about, we're going to try and dive back in. So,
I diagnosed myself with POTS, basically.
Yes, you diagnosed, yes, exactly. Yeah. Right, okay, good. Okay, so you took a year off, and during that time, were you just learning your new normal, PT? What did that look like for you?
Yeah, I would say the majority of that year was concussion recovery. So kind of like staying away from screens, slowly introducing screens in busy environments as I tolerated it. A lot of physiotherapy. I was seeing an osteopath, massage therapy, all of the therapies. And then at that point, I was doing lifestyle recommendations for POTS, like salts, compression stockings, and like graduated exercise protocols. But I would say the majority of that year, I was just waiting to be seen by a provider. And the situation in Canada is actually the wait list was 3 years to see a POTS doctor.
Oh my gosh, I thought my wait was bad. That is terrible.
Yeah, so I actually ended up going to Cleveland Clinic, so driving to the States and paying for private healthcare, and like I acknowledge that is such a privilege, and I don't take that lightly. But for people that like myself, like I was bedbound for a year, was thinking I could not come back to grad school. Like what am I going to do for my life? Like young government assistance, which I mean, like if you have to, like you have to, but like I just wanted a diagnosis. I needed answers, so. I hopped in the car, got an appointment at Cleveland Clinic, grabbed my mom, grabbed my wheelchair, got the tilt table done, and got a diagnosis that at least then we could move forward with, right?
Oh my gosh. Yeah. Wow. That's a big deal. So how long were you at Cleveland Clinic for?
I was only there for 2 days. So I was there for 1 day seeing the doctor. And then he said, okay, stay the night and then have your tilt table in the morning. So I had all that testing done. And they were actually really great. And they allowed me to get certain blood work done in Canada and kind of vice versa to keep the cost down. I've done every follow-up with him virtually. So it's been pretty accessible in that sense that it was just the one in-person visit.
That's really great. When did you know, like, okay, I can go back to school? Like, what was that turning point?
Yeah. So I would say it was definitely a bit rushed for me, and I didn't feel ready to go back to school. Symptoms were definitely unmanaged, and specifically, I get chronic migraine as well, which I was so flared when I was starting school again in the fall of 2022 when I was coming back, and I was just like, okay, just like take it one step at a time. I can always drop out again and join in the year after. And like somehow miraculously, I'm like still in this program, still making my way. I would say like I don't feel like my migraine symptoms, I've had a very interesting journey with. There's been periods of like complete remission. There have been periods where I've been like severe migraine for 9 months straight earlier this year. Like it's
Oh my gosh.
yeah, it's just like, it's there. I'm still here. I wouldn't say it's better. It's just kind of like, it's its own roller coaster that I'm on. POTS, I feel like I have improved throughout PA school, which is like, which is great. Or at least I'm coping with it better. In terms of like making those lifestyle recommendations. I'm on medication now, which I wasn't when I started. Needed to be on a beta blocker, like desperately. Like that medication really did change the game for me. And then using mobility aids, like I've kind of started my clinical year using a motorized wheelchair. Sometimes I've been using just my rollator. Sometimes I'm ambulating without a mobility aid. It kind of varies based on my symptoms, based on the setting, based on the expectations that are set on me. So, but overall, I feel like I'm managing it better.
That's awesome. Yeah, I go to work every day with my rollator, whether I need it or not. And it's actually just, I had a work party very late at 8 p.m. and I didn't have it. And my coworkers were like, "Oh, are you feeling better?" I'm like, no, I actually kind of become a normal person after 6 p.m. Like, my body just takes so long to, like, be able to ambulate. But, like, by 6 p.m., it's like, POTS who? Well, that's not true. I do still have my moments. But, like, it is crazy, like, how different. And even just day to day, like, it's just wild.
I have the exact same thing happening. Where when I did my general surgery rotation, we started at 7 a.m. And the very first thing you do is you round on patients throughout the hospital. So you're up, you're walking around, and like these surgeons were like speed walking to their patients. They were almost like running. And the first day I showed up with my rollator, and I was like, no, I was like, I need my wheelchair. Like, I was like, I'm not hemodynamically stable at this hour. But then, like, after lunch, sometimes I go from using a wheelchair to just walking. And people are like, what the heck is, like, what are you? And I'm like, I don't need to explain this, but, like, I'm good now. Like, don't worry about it. I had a lot of shame about that. Well, like, for the longest time, I would just stay in my wheelchair the whole day because I felt like people would judge me if I suddenly got up and started walking. But then I kind of realized that walking is good for me. The more I can walk, the more I can tolerate, the more I can build on that. And if I'm not like actively pushing myself to walk, I'm going to lose that skill. So I kind of just was like, whatever, people are going to think I'm whatever. And they can think that. And I'm going to be focusing on me.
It's hard, though, to convince yourself that to not care about what other people think.
Yeah. It took many months of me like mustering up the courage of like, oh, I'm just gonna get out on my lunch break. Oh, I'm just gonna get up to go grab this one thing. And then slowly it just turned into me walking the whole afternoon, and I like was like, whatever. This is what it is.
But how amazing that you could do that, though. Like, wow. It's huge.
For sure. And like super satisfying as well.
Oh, so satisfying. And you went back to school. Was it difficult to get accommodations? Like, how were they accommodating? Was it difficult? How did that go for you?
Yes. It's been an interesting process for sure. I would say, so I had accommodations prior to having POTS from having concussions in my undergraduate degree. And my experience getting accommodations in my undergraduate program at a different university versus the program that I'm at now was a very different experience. There were a lot of accommodations that I requested that unfortunately were not allowed or permitted because of the condensed nature of the program and just the high demands needed. So it was definitely challenging to find a balance between like getting the accommodations I need, but also having like the minimum competencies to pass the program. And so I also believe that I'm probably the first person who, like identifies with having a disability, or at least the first mobility aid user the program's ever had. So there was a lot of learning happening on both ends in terms of how I was sort of adapting clinical skills from performing them in a wheelchair, and like how I'm going to navigate spaces in the hospital and find accessible hospitals that will take me. It's been a big learning process. I would say I have had the accommodations to get me through, and I'm super grateful for them. I'm a huge advocate for anybody getting accommodations that meets them, because it really is like the equity that is leveling the playing field for us to even be in these spaces to begin with. I truthfully would not be finishing my program if I didn't have accommodations. Like seriously.
Wow. So has anyone else since you've been in the program come in with a disability, or has it still just been you?
Nothing that I can see like as a visible disability. There might have been people with invisible disabilities that I wasn't aware of, but in terms of like mobility aids, I'm pretty sure I'm the first. Like, we've had a lot of conversations where my program's been like, I don't know how you're going to be in the operating room. And I'm like, I don't know either. Like, but like, it's just been this back and forth of like, I think we've never encountered this before. And even the hospital that I was at for my surgery rotation, they said I was the first wheelchair user they had ever had at the hospital. And I was like, what? That's, not many of us.
Are important.
Yes.
Wow. Okay, so how much of school do you have left?
So I'm in my final 5 weeks of placement, and then I'm done.
Oh my gosh, that is so exciting. So do you have stuff in place for when school's over?
So I'm gonna take a break. I'm writing my licensing exam in April. So I'm basically just taking 2 months to like study full time and honestly just like take care of myself after this long stretch of school. Like I'm like, I need to sleep, I need to eat, I need to just take care of me. And then after that, I'm also going to take a break before like finding a job. Like I'm not worried about finding a job. Like I'm not stressed, and like I need some time to like recuperate. And there's so many things I haven't done since being chronically ill. Like I've never flown anywhere, and I've never had a vacation. So like I feel like that's long overdue, and just some time for myself.
So I think you mentioned you're the founder of Minorities in Medicine. Can you tell us a little bit about that?
Yeah, of course. So this is a not-for-profit organization that is aimed to increase the amount of minority applicants that are accepted into medical programs. So that could be med school, that could be PA school, so physician assistant school, there's practitioner school as well. Essentially what the program does is it matches up applicants with mentors that also self-identify with having minority status. And then they offer free mentorship as well as personal statement editing and interview preparation for those students. So essentially, it's just this big program that's trying to help minority applicants, including those with a disability, to try to see more of them in this space.
Wow. That's awesome. Is this just you, or you partnered with somebody else, or is this all?
So it's just me. So I'm the founder. I kind of like created it on a whim and was like, you know what? Let me just throw this out there and see if other people want to help be like a volunteer as part of the program. And I had such an overwhelmingly positive response with so many people where this like resonated with them that it's like very manageable just on my own, and like having this big team of volunteers that's helping me.
That's so awesome.
It's not registered yet, so it's more like it's like a club, like a not-for-profit club. But in the future, definitely, like if it's successful, like I have every intention to make it official, like registered nonprofit.
That's so awesome. Okay, so being someone with a chronic illness, what kind of like advantages do you think that brings to you being in the medical field when you're working with patients?
Yeah.
Do you feel like you have some special superpowers on connecting or what?
Yeah, 100%. There are so many benefits to having people that identify as disabled or having a chronic illness in medicine. I think one, just knowing what it's like on the other side, you kind of have a greater appreciation for things like quality of life and medications, and even just like how a provider interacts with you. Like, you know what it's like on the other side, you know what care you would like to receive. And I feel like at least that's the way I practice, is I try to like pay it forward and like, how would I like to be interacted with in this kind of a situation? So that's definitely one point. I think in terms of kind of niche areas of knowledge, like in terms of accessibility, is huge for making sure clinics are accessible, and making sure patients can be seen that have mobility issues. Right. And then also just representation in any field. I feel like if I had even seen another healthcare provider with a disability in my program going through this using a mobility aid, I think it would have made me feel a lot less alone and a lot more capable of finishing the program. So yeah, so many benefits, and like, we so deserve to be there. I think we bring so much to the table and like can help improve patient outcomes. And like, that's why I'm so passionate about minorities of medicine and getting more people like me in the field.
That's so great. And I think it was in my interview with Sammy, her EDS doctor has EDS, and she was just so passionate about making sure that Sammy would still find a way to dance. And it really helps with the patient care. Like, people, I took a class my senior year of college. It was about like basically how you talk to patients, and like the percentage of like people like getting better is just so much higher just based on how the practitioner speaks to the patients. Yeah. And so it's really important. So when did you decide to start sharing your story on social media?
Yeah. It's actually interesting because my Instagram has also gone through my entire life journey with me, because it originally was an athlete account that I had like tied to my windsurfing career. And so then when I started PA school, I just changed the name to the Surfer PA, because I kind of was like, this, like, sailing windsurfing account, this feels kind of unauthentic. I retired. Like, should I make this a personal account? Should I change it? And then I was like, you know what? I don't really want like a personal social media. Like, I'd rather it be like a PA school like account where I share things about going into PA school and like my transition from being an athlete to being a PA student and onwards. And then somewhere along the way, I became disabled and I developed a chronic illness. And then that kind of just became part of the account. And I found that I got, like, it's very rewarding posting awareness about POTS, about my medical issues to share with others. It also was a great sense of support for me to really connect with other people, because I feel like I'm not surrounded by people with chronic illnesses or disabilities in everyday life. Like, I'm very much the minority in my profession. So it was a very nice, supportive way to connect with others. And yeah, I just really enjoy making content in that sense and find it really rewarding.
That's awesome. What an evolution of your Instagram.
Yes. If you scroll back, it goes way, way,
wow,
way back.
I need to scroll back. That is so interesting. Was it hard for you to shift kind of the way that your Instagram was going?
For sure. I would say when I was an athlete, I was all about like posting the perfect picture and like making sure like everything looked perfect and like very like curated. And even like to a certain degree when I was starting PA school, that was the sense too. And I think as I've evolved, I've kind of been a little bit more relaxed and showing more like realities and more realistic things, like sharing both like positive and negative things, like vulnerabilities about myself. And definitely taken a turn in a good way, I think. Yeah.
Has anyone in the medical field with disability reached out to you, like over social media, asking for advice or anything, or they've been thinking about going into the medical field?
For sure. I get a lot of DMs from people in similar situations, whether they're in med school, PA school, other programs, just at university in general. Specifically a lot about like the discrimination that they also face. Like sometimes I'll share on my story, like, hey, this happened to me. Like, what do you think about that? Like, what is going on here? Like, is this discrimination? Is this like, am I being sensitive? Like, what's happening?
Right. Yeah.
I think the general consensus is like, there's a lot of ableism in medicine. It's kind of inherently built in the field. You know, people don't get into the field unless they have the best grades, all the extracurriculars. Like, they're just like the top 1% of the top 1%. And, you know, there's a lot of barriers for people with disabilities to be in that 1%. And so, yeah, I do get a lot of DMs from people with disabilities just sharing the same story so that they feel less alone, sharing that they've also been discriminated with, or like questions about, you know, like how should I put this on my application in my medical school applications that I am disabled? Like, how should I navigate this?
It's surprising and also surprising, not surprising, because I feel like people who understand medicine should naturally be more understanding of how we're not robots and not every body is like perfect, and that shouldn't keep someone from pursuing medicine. It's surprising and not surprising that there is so much ableism in the medical field.
I've definitely been surprised, specifically like in my clinical training, with how much it's everywhere. And just even like my supervisors or bosses, like, people just don't know how to interact with folks with disabilities. It's so interesting. And you don't realize this until you have it and you're in the space yourself. And then you're like, wow, like there is so much education that needs to happen in this world.
I'm sorry that it's been so difficult, but it is so important that you're sharing your story, and I'm so glad that people reach out to you. Do you have any tips for people who are not pursuing medicine yet and they have a chronic illness, but they want to?
Yeah. The first thing I would say is that just because you don't see people like you in the field doesn't mean you don't belong. And there are, unfortunately, going to be a lot of people who tell you that it's not in your best interest to pursue this field. And to that, I would say, like, that's not for them to decide. Like, you're more than capable of doing anything with the right accommodations. And I think with the right accommodations, there's very little that we can't do in an occupational setting. Yeah. So, like, definitely apply, definitely share your story. I think you deserve to be in this field as well. And again, like, there's so many strengths that chronically ill or disabled folks bring into the healthcare field, that shouldn't stop you from at least trying.
So much empathy, like meeting with someone with a chronic illness, and it really does benefit patients so much. Okay, that's some really good advice. Do you have any projects you're working on and they need like to plug or share?
Yeah, I can give a plug. I'll just say, like, with Minorities of Medicine, so on Instagram, it's at Minorities of Med. We're a very, very new organization. We would be more than happy to have any volunteers come join us if you are someone who identifies as a minority and works in healthcare. If you just want to help with our social media or anything at all, more than happy to have you on board. And likewise, if you are a applicant to a medicine program, more than happy to have you apply. There's a link in our bio on the Instagram page where you can fill it out for both of those roles if you feel so inclined.
So, it was so nice meeting you. And for those who are listening, we've been trying to plan this for a while, but we both have been canceling on each other.
Yes. We've both been like sharing inopportune times.
Yes, literally. Thank you so much, Olivia. Okay, so before we go, your Instagram is at the Surfer PA?
Yes, the Surfer PA.
The Surfer PA. Okay, awesome. Thank you.
Thank you so much.
Thanks so much for tuning in to this week's episode of the Chronically Positive Podcast. Please, if you haven't already, subscribe, follow, share, rate. It helps so much getting the show out to people who could benefit from it. We have 2 episodes left in this season. We are coming to a close. I think it'll be a total of 10 episodes. And the last 2 guests I'm so excited about, and I can't wait to release the theme of next season. It's really exciting. I think it's a topic that people with chronic illnesses are really going to benefit from. It's much needed. I will share this news in my last episode, which will be January 28th. Anyways, thank you so much for tuning in, and as always, your journey matters.